Okay, so let's talk about the gross anatomy of the thoracic wall and the thoracic cage. This is the first lecture when we're talking about thorax, abdomen, pelvis, and perineum. The thoracic wall encloses the thoracic cavity and protects important organs like the heart, the lungs, the great vessels, and plays a very important role in, breathing, respiration. Now, the thoracic cage is the bony, and cartilaginous framework that gives this wall its shape and strength. Now, when we talk about thoracic cage, it consists of the sternum, okay, what they call the breastbone, 12 pairs of ribs and costal cartilages, 12 thoracic vertebrae and their intervertebral disc. Okay, now let's talk about the sternum. The sternum is actually a flat bone in the midline of the anterior chest wall. Okay, it has different parts. It has the manubrium sterni. Okay, it has that articulates with the clavicle. Remember to form the sternoclavicular joint. You also have the first costal cartilage, articulates with the first costal cartilage. It has a jugular notch, okay, and it also has a sternal angle of Louis, which is at the junction of the manubrium, sternum, the manubrium, and the sternal joint. Okay, it also has a body. Okay, the body is long, okay, the longest part actually of the sternum. This one articulates with the costal cartilage of rib 2 to 7. Okay, then it has the third part, the smaller one here called the xiphoid process. Okay, that one is small and very variable. Okay, it's actually serves as a landmark for inferior border of the heart and the diaphragm attachment. Now, what is the clinical importance of the sternal angle? Well, the sternal angle, coincide with different important areas of inside the thorax. Okay, so for example, the level is of the second rib, the T4 to T5 intervertebral disc posteriorly, the trachea bifurcation. Okay, that's the point where the trachea bifurcates and also marks the beginning and end of the aortic arc. Okay, now let's talk about the ribs. The ribs, there are different classification. Okay, we have true ribs and false rib. All right, true rib and false rib. Okay, the true ribs are rib 1 to 7. Now these true ribs are true because they attach directly to the sternum. All these rib 1 to 7 attach directly to the sternum. Now false rib are rib 8 to 10. The reason why they are false rib is because they are attached, okay, via a costal margin, so which means that they are attached to a costal margin that is now attached directly to the sternum. So they are not true ribs, they are false rib, and this is rib 8 to 10. Now there's also some rib called floating ribs. This one they don't get where they attach at all. Okay, so this one is 11 to 12. No anterior attachment, they're just floating. Okay, now ribs can also be classified into two. Again, we have typical rib and atypical rib. Typical ribs are rib 3 to 9. And what are the features of a typical rib? The typical rib, we have a head with two facets. Okay, to have a head with two facets, a superior and inferior facet. Okay, now it will have a neck, it will have a tubercle. This tubercle articulates with a transverse process, and of course it will have a shaft and then the costal groove. Okay, this costal groove contain a vein, that is vein, artery, and nerve. What about the atypical ribs? Now for atypical ribs, we have rib 1, the first rib. This one is actually the shortest, and it's broad, and then contain a tubercle called the scaling tubercle for the scaling muscle. Then we have the second rib. This second rib has a tuberosity for the serratus anterior. Okay, then we have the 10th rib, which has just a single facet. Okay, and then we have 11 to 12 ribs, which of course floating ribs. They have no tubercle at all. Now let's talk about, if you remember, okay, well, it's a video, so you can always go back. So for thoracic vertebra, there are 12 thoracic vertebra, which is T1 to T12. This T1 to T12 vertebra, they are actually heart-shaped. They have a heart-shaped body. They have a costal facet for the ribs. That's where the ribs attach to. And then it's long. downward and sloping spinous processes. That it has a long downward sloping spinous processes. Okay. Then we also have intercostal spaces. There are spaces called intercostal spaces. I think no, I don't think. I know that there are 11 intercostal spaces, each of them containing intercostal muscle, intercostal nerve, and intercostal vessels. All right. Now, what about the muscles of the thoracic wall? The muscles of the thoracic wall, we have quite a number. Let's talk about the intercostal muscle. Intercostal muscle are external intercostal. Okay, the fibers run downward, and then forward. Yeah, that's true. Then we have what is their function? What is their function? Their function is to actually to elevate the ribs during inspiration. During inspiration, okay. Then we have the internal intercostal muscle. This one, the fibers run downward and backward. Yes. It has an interosseous part for expiration. It has an interchondral part for inspiration. Okay. Then we have the innermost. The innermost intercostal muscles. This one acts with the internal intercostal. Okay. So they do the same job. There are other muscles, like I said, there are lots of them. The other muscles, we have the subcostalis, we have the transverse thoracis, we have the serratus anterior, we have the pectoralis major and the minor muscles. So yeah, they are muscles of the thorax. Now for neurovascular supply, intercostal neurovascular bundle, okay, which supply the thoracic wall, is located in the costal groove in a particular order. Remember when I say van, so which means from superior to inferior, we have the vein, the artery, and the intercostal nerve. So intercostal vein, intercostal artery, and intercostal nerve. Now, talking about the blood supply, the thorax gets its blood supply from the posterior intercostal artery, which is directly from the thoracic aorta, and the anterior intercostal artery, which of course a branch from the internal thoracic artery. For nerve supply, the intercostal nerve supplies it. The intercostal nerve, that's the ventral rami of T1 to T11. For a subcostal nerve, that's T12, also supplies it. Now, there's something important, that which is the movement of the thoracic wall, because you can't just talk about anatomy without talking about the function. Okay, what are the movements of the thoracic wall? The movement of the thoracic wall has two typical movements. There are movements that have been linked to pop handle movement. Okay, so we have pop handle movement and the bucket handle movement. For pump handle movement, upper ribs, that's the 2 to 6 rib, okay, evolve 2 to 6 rib. This one increases anterior posteriorly in diameter, so anterior and then posteriorly in diameter. For bucket handle movement, the lower rims are actually involved, which is rib 7 to 10. This one increases transverse diameter instead of the anterior posterior diameter that happens in pump handle movement. Now, what about the fascias and the linings? Well, the thoracic wall has what we call the endothoracic fascia, and of course the parietal pleura, which lines the inner surface, okay, that relates to the lung. The clinical anatomy: rib fracture. Rib can fracture, which is a risk of a pneumothorax. Flail chest, when there's a paradoxical movement. Then we have the thoracocentesis. This is when needle is inserted above upper border of the rib. Then we have costochondritis. This is chest wall pain. It can happen. So in summary, thoracic cage provides protection and mobility. Intercostal muscles are key to inspiration, and neurovascular structures are at risk during procedures. So a lot of things compacted. So the thoracic wall, just like soldiers in the war, they protect the castle because the chest contains very important structures that supply the other part of the body, like the heart. So very, very important. So have a nice day. I will give an assignment for you people to do this and submit tomorrow. All right. Thank you. Peace.